We have a dispiriting shortage of high-quality health research for many reasons, including the fact that it's expensive, difficult, and time-consuming. But one reason is more insidious. Sometimes groups seek to intimidate and threaten scientists, scaring them off promising work. That's the topic of this week's Healthcare Triage. By the time we did an episode on the health effects of lead almost 2 years ago, few were questioning the science on the issue, but that has not always been the case. In the 1980s, various interests tried to suppress the work of Dr. Herbert Needleman and his colleagues on the effects of lead exposure. Not happy with Dr. Needleman's findings, the lead industry got both the Federal Office for Scientific Integrity and the University of Pittsburgh to conduct intrusive investigations into his work and character. He was eventually vindicated, and his discoveries would go on to improve the lives of children all over the country. But it was a terrible experience for him. I often complain here on the show about a lack of solid evidence on guns' relationship to public health. There's a reason for that deficiency. In the 1990s, when health services researchers produced work on the dangers posed by firearms, those who disagreed with the results tried to have the National Center for Injury Prevention and Control shut down. They failed, but getting such work funded became nearly impossible after that. The area I complain about most, though, concerns nutrition, including supplements. That domain allows us to focus on another type of intimidation: lawsuits. In 2013, scientists at the Food and Drug Administration published a study in the Journal of Pharmaceutical and Biomedical Analysis showing that 9 brands of dietary supplements sold in the United States contained a synthetic analog of amphetamine. The authors noted that the efficacy and safety of this stimulant, beta-methylphenylethylamine, or BMPEA, had never been studied in humans. Canadian health authorities recalled supplements containing the stimulant, noting the potential for serious cardiovascular complications. The FDA, inexplicably, remained silent. The agency did not warn the public, recall products, or warn manufacturers. Dr. Peter Cohen, an associate professor of medicine at Harvard Medical School, replicated aspects of the 2013 study and came to the same conclusion as the FDA experts. The stimulant was available in multiple brands of supplements, and a comprehensive review of the biomedical and chemistry literature found not a single study of the stimulant's efficacy or safety in humans. These results were published in Drug Testing and Analysis in 2015 and widely disseminated by national and international media outlets. 2 weeks after that, the FDA alerted consumers that the stimulant was potentially dangerous and warned manufacturers to remove it from their products. One of the companies that received an FDA warning letter, in turn, sued Dr. Cohen for $200 million in damages for libel, alleging that statements in the peer review article and subsequent interviews with the media were false. The company asserted, without supporting scientific evidence, that while the article said the stimulant was not natural, it had extracted it from a Mexican shrub. Company officials also claimed that they had evidence of the stimulant's efficacy and safety in humans. The lawsuit, initially filed in Georgia, was dismissed because of lack of jurisdiction there, then refiled in federal court in Massachusetts. During the lawsuit's discovery phase, the supplement company demanded and received access to emails related to the study, including those with co-authors, journal editors, the FDA, outside experts, and the news media. The company also demanded and received all revisions of the manuscript, as well as peer reviewers' comments and the author's responses. Despite the absence of evidence of wrongdoing, the judge allowed the case to go to trial. Dr. Cohen got entangled in what legal scholars call a strategic lawsuit against public participation, or SLAPP. Anti-SLAPP laws are intended to prevent people from using courts, and even the threat of a lawsuit, to intimidate people who are exercising their First Amendment rights. But in Dr. Cohen's case, the court refused to give full weight to Massachusetts' anti-SLAPP statute on the ground that dismissing the case would undermine the supplement company's constitutional right to a jury trial. Although the jury eventually found for the defense, the experience was extremely upsetting. Peter told me, and I'm quoting, "Preparation for the trial included a 6-hour deposition, a mock trial, and a review of more than 4,000 pages of studies, emails, correspondences, drafts, and depositions. The trial itself lasted 7 days and put my family through the ringer." He was fortunate to have the full support of his university in defending his work. Peter and I, along with Nicholas Bagley, law professor at the University of Michigan and friend of the show, recently wrote in JAMA Internal Medicine about the damage such suits inflict on scientific inquiry. We pointed out that the peer review process already provides a way to question discretion to studies' conclusions before publication, and that less formal peer review continues afterward in the form of letters to the editor and editorials. If errors or mistakes are believed to be fraud, mechanisms for review exist in university systems. Only if evidence of fraud surfaces does it make sense for courts to be brought into play. Quoting Nick here, "Courts aren't equipped to referee scientific disputes, and they have an obligation to prevent unscrupulous plaintiffs from abusing the machinery of justice to stifle science." Lawsuits like these are too common in health research. Nick did a fairly comprehensive search of the reported opinions over the past 40 years. He found 2 cases in the 80s and 2 in the 90s. Since 2000, however, there have been 10. These numbers greatly understate the number of filed cases, however, since the vast majority are settled. The manufacturer of a hip protector sued a researcher in 2008 over a study published in JAMA that showed the device didn't prevent fractures. The CEO of a pharmaceutical company sued a researcher who led his data monitoring committee when the researcher published a 2011 article in Annals of Internal Medicine disputing the way the CEO had described his study results. Lawsuits like these aren't necessarily bound by ideology or partisan politics. Mark Jacobson, an energy systems engineer at Stanford University, is suing the National Academy of Sciences and the authors of a recent paper published in the Academy's journal, PNAS. The paper criticized Mr. Jacobson's analysis that the United States could fully power itself with wind, water, and solar energy. Many, including some identified as environmentalists, have criticized the lawsuit. For his part, Peter remains undeterred. Last month, he published a new paper finding that experimental stimulants continue to be placed in sports and weight loss supplements. That's what research is supposed to do. Give us more data so that we can make better decisions about our health. We love to make videos about things that sometimes YouTube doesn't like to sell to advertisers, and we're fine with that because what we do is more important than the money we might make. That said, any support you can give us to help keep the show going helps to make it bigger and better, and one good way to do that is through a subscription service called patreon.com. You can go to patreon.com/healthcaretriage, give as little as $1 a month to help the show keep going. If you don't, that's fine, we're gonna keep on making it anyway. We'd also appreciate if you subscribe to the show and maybe like the video if you liked it. That'd be great too. We also have some great merch you might like. We have mugs and posters and lunch boxes and other stuff, and you can check it all out at hctmerch.com. I also have my book, still available anywhere books are sold, The Bad Fruit Bible. I'd really appreciate it if you pick up a copy.